A client asked me the other day, Mike, if dietary cholesterol doesn't impact serum cholesterol, what does? And so what I wanted to do is provide to you a deep dive into the literature, because many of you go to your doctor and your doctor finds out that you have elevated LDL or total cholesterol. And so therefore you should cut cholesterol out of your diet. And I want to share with you this systematic review and meta-analysis titled The Effects of Food on LDL Cholesterol Levels, a systematic review of the accumulated evidence from systematic reviews and meta-analysis of randomized controlled trials. I know it's a lot of jargon here. Essentially, what this analysis looked at is which foods actually significantly impact serum cholesterol. And as you will soon learn, it is not high cholesterol foods like eggs or meat. It is other foods. So I think it's important that we all take a step back and think about why our serum LDL levels could be high and what does that mean? And should we be concerned about that and other biomarkers? We're going to focus on the liver. We're going to talk a lot about apolipoproteins like apolipoprotein B, also known as ApoB, apolipoprotein A1, ApoA1, which is on HDL cholesterol. ApoB is found on your chylomicrons, your vLDL, your remnants or IDL and LDL particles. So interesting review here. So essentially, when it comes to high cholesterol foods, now you might be thinking, well, what foods are high cholesterol? Well, cholesterol is a molecule that is relegated to mammals and animals. So if you eat a plant-based diet, you're not getting any cholesterol from your diet. Now, that doesn't mean that your cholesterol levels can't be high if you're on a vegan or low meat diet, because we know that insulin regulates the enzyme that actually synthesizes endogenous cholesterol known as HMG-CoA reductase, which is how statins work. They block that rate-limiting enzyme. Anyway, let's focus in on eggs and meat for a moment here. I think it's quite interesting because these are high cholesterol foods. Now, as discussed in this most recent systematic review, there may be large individual differences in response to dietary cholesterol, which may partly explain the inconsistency of the results. However, with regard to the overall claim that dietary cholesterol and eggs can increase LDL cholesterol, the evidence was considered low or had a small effect. Moreover, the effects of red meat may require further clarification, meaning that dietary cholesterol does not have a significant impact on serum cholesterol. Now, some of you might be saying, Mike, why are you talking about cholesterol anyway? It's just an association. We know that thrombotic factors like fibrinogen or looking at ApoB is much more nuanced and so forth. And I get that. But again, most of you are going to your primary care doctor and your doctor is seeing your cholesterol is elevated, even though all these other biomarkers are improving and they're telling you to eat less cholesterol in your diet. So let's actually look at what increases cholesterol, just so you have a better idea. This is a nice visual. As you can see here, guess what is on the left here? Sugar. So we know that carbohydrates increase LDL and total cholesterol levels, and also excessive amounts of processed carbohydrates like sugars and soda and candy and ice cream and donuts. Well, guess what? That increases insulin. Insulin is linked with LDL receptor expression and the activity of the enzyme HMG-CoA that is the rate-limiting enzyme for making LDL cholesterol. So as you see here, other foods that you eat in your diet potentially could actually decrease your LDL cholesterol, some of which I consider healthy, others I don't. As you can see here, of course, most of these articles are focused on plant-based foods and stuff. You can see here, soluble fiber, oats and barley and so forth can actually decrease cholesterol, because we know that a lot of cholesterol that's not being used to make cell membranes or vitamin D. We know cholesterol is the building block for all your steroidal hormones, including but not limited to testosterone, cortisol, aldosterone, estrogen, all these different hormones, DHEA. There's LDL receptors on your gonads, on your adrenal glands. We know that cholesterol actually is an immune modulator. Your macrophages take up cholesterol. We know cholesterol has antiviral properties, and there was a study showing this was just an association study. We don't know the mechanisms or the direction of causality, but people with lower serum cholesterol had an increased odds of having more severe COVID-19. So anyway, let's go back to the study. And so what you see here is liquid fats, and actually unfiltered coffee, for whatever reason, can increase LDL cholesterol. Now, that doesn't mean that you don't drink unfiltered coffee. I mean, it's just there's an association here. It's not really known mechanistically what impact or how coffee can impact cholesterol, but that is actually if you look at the foods here, you might consider coffee the most unhealthy thing if you care about cholesterol. It's actually associated with the highest levels of LDL cholesterol for whatever reason. Now, I think that has to do more with how caffeine affects lipoprotein lipase and some of the lipolytic enzymes and so forth. But anyhow, on the other side of the graph, some foods that you might want to consider: having green tea Avocado, I think, is a very healthy food. Walnuts, almonds, hazelnuts and things are very healthy. Fish has a neutral effect on LDL cholesterol. Turmeric may lower LDL cholesterol. Now, I want to continue on here and talk about actually how low cholesterol diets have been shown to actually increase endogenous production of cholesterol because you're not getting it from the diet. And so this is the image here of just like a cell within your liver. It actually could be a cell in another part of the body, but largely the liver cell, the hepatocytes are involved in the endogenous or the body's synthesis of cholesterol. What you see here in a low cholesterol diet is actually an increase in the enzyme known as HMG-CoA reductase. Again, statins inhibit this enzyme. This is how statins work. And you see an expression of the LDL receptors in a low cholesterol diet. So there's an extracellular portion of the liver cell. There's more LDL receptors, but in a high cholesterol diet, there's less LDL receptors because you're getting it from the diet. And actually the activity of the enzyme HMG-CoA reductase is reduced in a high cholesterol diet. And so this image is from the paper Mechanistic Insights into the Oxidized Low-Density Lipoprotein-Induced Atherosclerosis. So I think this is quite fascinating. So we're going to continue on, friends, but I just want to thank you for being here. As always, if you're enjoying the content, please hit that like button. Be sure to share this video with a friend via text message and leave a comment below. That goes a long way. I'm very curious to know if you're fascinated by this topic because it seems to be top of mind for a lot of people. And also, you can help support our show notes creation and video production by supporting our sister company, Myoscience. Today, we're talking a lot about metabolic health. We're going to talk about insulin in just a moment, how insulin can actually upregulate endogenous cholesterol levels and create all these modifications on the low-density lipoproteins if you have poor metabolic health. And one tool that can really help support your intermittent fasting lifestyle, your low-carb lifestyle, is berberine fasting accelerator. This works best when taken at night. 2 to 3 capsules around dinner time or shortly after dinner time can help kickstart the fasting physiology and help to increase ketone levels and support metabolic health. You can check out, there's over 150 reviews from real life customers like you at our sister company, Myoscience. Check out the reviews, see what people are saying. A lot of people are reporting that when taken around dinner time, this helps to curb appetite, cravings, and food cravings for some of those snacky type foods, the crackers, cookies, treats, and so forth in the evening time. We know eating close to bed is counterproductive for maintaining a healthy body composition. So support your metabolic health and healthy body composition by checking out the berberine fasting accelerator. Links are below. Use the code podcast to save. All right. Let's get into cholesterol absorption. So I think this is an aspect of cholesterol metabolism and lipid metabolism that is not so well understood. Exactly trying to figure out how much of your serum cholesterol is from absorbed cholesterol or from endogenous production. Well, based upon the evidence that I've read and podcasts that I've listened to with people who are way more knowledgeable in this area than me, like Dr. Peter Attia and others, suggest that dietary cholesterol doesn't really significantly impact serum cholesterol. And as you just heard from that systematic review, eggs and meat have a minimal, if any, impact on serum cholesterol. And this recently published study in 2021 titled The Effect of Dietary Macronutrients on Intestinal Cholesterol Absorption and Endogenous Cholesterol Synthesis, a randomized crossover trial. They say, in conclusion, this study shows that consumption of a single high-fat, high-carbohydrate, high-protein meal did not significantly alter or affect intestinal cholesterol absorption levels or total cholesterol concentrations. And so again, this data is weak at best, showing that ingesting cholesterol from your diet has a significant impact on serum cholesterol. It's more about endogenous production. And so this study was a randomized crossover trial. They had a high-fat meal, high-carb meal, minimal impacts in post-meal cholesterol absorption or synthesis using different analysis. Now, the systematic review concludes, although LDL cholesterol is causally related to atherosclerotic cardiovascular disease, foods are complex by nature and may have divergent effects on both known and unknown risk factors. Moreover, the effect of red meat may require further clarification. That is to say that red meat doesn't significantly increase serum LDL cholesterol levels. And this is the most important sentence of the study. They say, in such instances, priority should always be given to patient-oriented health outcomes. Now let's translate that into layman's terms. What that means is that if you're eating a diet that is improving your metabolic health, improving your body composition, lowering your blood pressure, increasing your energy and your cognitive function, Should you really be concerned about the fact that that diet may also be increasing your LDL cholesterol levels? That's how I interpret this. Now, of course, I'm biased, but we see many people, they go on a lower carbohydrate diet. They start exercising more. They're losing the belly fat. They're off their medications. They're feeling good, but the doctor's like, well, I'm worried about your LDL cholesterol levels. Well, could that be an artifact of increased fat metabolism, of increased utilization of fats for fuel, ketone metabolites? And as it turns out, the raw material to make cholesterol is acetyl-CoA, and that is increased on a ketogenic diet. Two molecules, essentially, I'm really simplifying down the biochemistry, but when you take two molecules of acetyl-CoA, you essentially make beta-hydroxybutyrate. There's a few steps involved in addition to that, but if we're making a lot of ketones and utilizing fat for fuel by way of acetyl-CoA, we're probably going to be increasing our LDL cholesterol levels. Now, with that in context, what is the relationship between LDL cholesterol levels and insulin? This study did a great job of helping us to better understand that. The title of this paper is The Reciprocal Relationship Between LDL Metabolism and Type 2 Diabetes. The scientists say type 2 diabetes mellitus and insulin resistance feature substantial modifications of the lipoprotein profile, including a higher proportion of smaller and denser low-density lipoprotein particles. By the way, these particles can become glycated as well as oxidized. And I think that's the important point here is when we have underlying insulin resistance and metabolic dysfunction, not only do we have a higher prevalence potentially of LDL particles, but the particles are smaller, denser, and they're more likely to become modified and therefore atherogenic. That's the important, I think, the most important soundbite from this entire video. You know, if you have something busy to go do right now, you've heard the punchline. And again, that is that metabolic dysfunction modifies our lipoprotein particles, rendering them more atherogenic, susceptible to become infiltrated within the vascular endothelium, leading to the cardiovascular sequelae, such as stenosis or occlusion of the arteries. The scientists say, in addition, qualitative changes occur in the composition and structure of LDL, including the changes in the electrophoretic mobility, enrichment of the LDL with triglycerides and ceramides, prolonged retention or modification in LDL and plasma, and uptake by macrophages, and the formation of foam cells. These modifications affect LDL's function and favor an increased risk of cardiovascular disease in diabetic individuals. So if we translate that jargon into layman takeaways, they're alluding to the fact that it's not just that LDL is higher, it's dysfunctional, it's modified, it's structurally different, and therefore functionally different. And that's where this image is quite phenomenal here. You see the modifications, the changes, the oxidation, and the glycation of LDL in the context of insulin resistant. And essentially what you see here, and they use, again, this is a jargonistic term, but it really solidifies what we're saying. The lipidome is altered. The LDL is enriched in triglycerides and ceramides. It can become glycosylated or glycated. And there's a higher prevalence of oxidation here in the particles, which render the particles more atherogenic. So we need to move the conversation away from quantities of LDL to the quality. What is the functional difference between a metabolically healthy person who has high LDL cholesterol versus a metabolically unhealthy person who has high LDL cholesterol? And I think this is an important consideration, and that's why in the Blood Work Masterclass, we take a deep dive into liver health and looking at the liver enzymes, triglyceride levels, ApoB to A1 ratios, all of these to give people a better insight into understanding the quality of their LDL, the size, and putting that in context with metabolic health. And so you can see here all of these different studies, but there's another study talking about how low-density lipoprotein cholesterol, LDL cholesterol levels are associated with insulin secretion and insulin resistance. And essentially what this analysis found, I think this was from 2021, the investigators detected significant positive associations between fasting LDL cholesterol concentrations and C-peptide levels, meaning that there was an insulin-dependent effect on LDL concentrations. And so we know that we need to start focusing again on metabolic health because there is this correlation. In fact, one side effect of taking a statin or an HMG-CoA reductase inhibitor, different types of statins, is diabetes. And so there's this co-occurrence or this shared mechanistic machinery between cholesterol biosynthesis and metabolism and insulin. And so I think that's the biggest take home. Now, going on here, I think it is important to recognize that LDL cholesterol has positive effects. We know that there's LDL cholesterol receptors, as I mentioned before, on the adrenal glands, on the gonads in both men and women. And LDL cholesterol is used to make these steroidal hormones, aldosterone, testosterone, cortisol, estrogen, DHEA, also vitamin D. And so when we focus on low cholesterol diets and cholesterol lowering at all costs, what we might be doing is having iatrogenesis or unintended harms by lowering estrogens or lowering cortisol or lowering aldosterone or DHA or even vitamin D. And so as it turns out, the cholesterol that's not absorbed or not used, guess what? It gets dumped in the intestines to make bile. And so bile acids are part of the cholesterol backbone is needed to bind and make bile. Bile is needed to absorb fat-soluble vitamins, coenzyme Q10, vitamin D, vitamin K, all these vitamin E, beta-carotene, all these fat-soluble vitamin A, if I didn't mention it, are dependent upon bile to be released and in utilization. So, I think this is a very complex topic, and cholesterol metabolism can't be just relegated down to one enzyme, HMG-CoA reductase. We need to look back and take a 50,000 foot view and look at overall metabolic health. And so I think that the take home here is if your LDL cholesterol is high, but you're metabolically healthy, should you be totally concerned about that? Well, again, it depends on your fibrinogen levels. It depends on ApoB to A1 ratios. It depends on maybe your omega-3 index and how physically active you are. But I don't think we should be excessively concerned about a high LDL in absence of poor metabolic health. If we have high LDL and good metabolic health, it's probably not an imminent health concern. And the literature is showing that as well. Okay. Now, let's continue on here and talk more about potentially the problems with the industrial seed oils and LDL oxidation. So we do know that the problem with LDL cholesterol is it can become modified or oxidized. And it turns out that having a diet enriched in industrial seed oils and linoleic acid might exacerbate or foster the oxidation or modification of LDL cholesterol and potentially lipoprotein A that can lead to atherosclerosis. And so I know a lot of people are concerned about omega-6s or PUFAs in the diet. And in my estimation, this is the biggest concern, is that if you have a diet enriched in these industrial seed oils and you have a high LDL particle number, you can increase the propensity of these LDL particles to become modified or oxidized and therefore render them more atherogenic or heart disease causing. And this is a great image here. It just shows you the ApoB and the oxidized ApoB and the differences here. And those oxidized particles can be engulfed by macrophages and form these fatty streaks and create the narrowing or the stenosis or the occlusion in the coronary arteries, which are the most concerning. The arteries, the arterial system that feeds the heart, when it becomes occluded, you get necrosis and get an infarct or a heart attack, and you can potentially die. And so by omitting these oils in the diet, and they're mostly found in processed foods, junk foods, cookies, crackers, treats, or when you go out to dinner, oftentimes things are cooked in these seed oils, and that can be problematic. So again, we need to also recognize that LDL cholesterol has antiviral properties. And so especially in elderly people, advising them to avoid eggs, avoid red meat and things, and lower their LDL cholesterol at all costs, it might actually have an immunologic detriment because we know that these lipoproteins can bind to bacterial endotoxins as well as viral particles. And this is not like conspiracy theories. This has been widely recognized. I talked about it extensively in 2012 in my book, Belly Fat Effect. And again, we talked about the hormones. We know hormones decline with age. So should we really be so scared of cholesterol? I think nuance is omitted from this LDL cholesterol story, and the science is finally catching up. And so again, why might serum cholesterol be elevated in someone who is eating a low carbohydrate or zero carbohydrate diet? Well, we know that acetyl-CoA is the building block. It's a Krebs cycle metabolite, and when you are lipolyzing fats from your fat cell and utilizing more fat as energy sources, making ketones and such, acetyl-CoA is the starting molecule for beta-hydroxybutyrate and ketones, acetoacetate, and so forth. It also happens to be the starting molecule for the building block of cholesterol. And then the rate-limiting enzyme that I mentioned, HMG-CoA, takes acetyl-CoA down this complex, convoluted pathway to make cholesterol. And so it could just be that people who are more metabolically healthy, so-called fat adapted, not depending upon exogenous carbohydrates as a primary energy source, might be utilizing more fats for fuel, particularly in the brain and other metabolically demanding organs like the heart and so forth. And so their acetyl-CoA pool is just higher, and that could lead to higher levels of LDL cholesterol. And so I think the important point here to recognize, and that we'll end it here, is metabolic derangements such as insulin resistance and prediabetes and physical inactivity increase the production of triglycerides, which can lead to hepatic steatohepatitis. And that is the formation of fats in the liver that lead to elevated levels of triglycerides and vLDL cholesterol. And so I think this is why the liver is really a nice gateway into understanding someone's metabolic health. And when people start to become metabolically unhealthy, their liver takes the brunt of this first, and you often see a rise in these liver enzymes and a concomitant rise in vLDL and LDL cholesterol. So I think that's important to recognize. The investigators say these lipoproteins are ultimately converted by lipolysis to IDLs, the intermediate density lipoproteins, and then to the LDLs, the low density lipoproteins, both of which are atherogenic. And elevated triglycerides can alter the particle diameter and content of the LDLs. So I think it's really important to recognize that there's nuance here. So when you go to the doctor and they see your labs and they say, Sally, your LDL cholesterol is high. I need you to stop eating red meat and eggs. You say, well, actually, I just watched this video on YouTube and there was many peer-reviewed academic studies cited, and there was a systematic review of multiple studies showing no association with consuming cholesterol from eggs and meat and an increase in LDL cholesterol. You can tell them there's literally systematic reviews out there that show this. And it's more about the metabolic health, doctor. And I test my glucose at home, look at my hemoglobin A1C, look at my triglycerides, look at my liver enzymes, look at my fasting insulin. These are all in the healthy range. I'm not concerned about my LDL cholesterol. I would be curious to know what your doctor says if you were to say it in those words. That would be a quite interesting discussion, and I think might open the opportunity to have a more intellectually stimulating conversation with your doctor and cause them to think a little bit differently about the problems with LDL cholesterol in metabolically healthy people. So as always, friends, I really appreciate you tuning all the way in. Thank you for sharing this video. Thanks for hitting that like button and subscribing. Let me know what you think of this in the comments, and we'll catch you on a future video down the road. Bye now.